Welcome back to the East Meets West podcast on health and medicine. I'm your host, Dr. David Cherian. I have a background in Western medicine. I'm a practicing physician in Houston, Texas. And I also have a background in Chinese medicine. I am a licensed acupuncturist here in Texas. And this is the podcast where we go through just different health conditions and we talk about it from both a Eastern Chinese medicine perspective as well as a Western perspective. And I try to bring in insights from my years of practice with both and how they have shared similarities and also differences in the treatment approach and how it might be beneficial for you if you are suffering from any of these conditions and what Chinese medicine may especially be able to do to help you. So as always, you can always find out more information of our clinic at www.houstonacupuncture.com. And with all that saying, let's get into today's topic. Today, I wanted to talk about a condition called peripartum depression. And just the name peripartum is similar to a much more common name that you might be aware of called postpartum depression. And postpartum depression is a little more commonly known, and the term peripartum depression is actually similar. Postpartum means depression that happens after the delivery of your baby, and it tends to occur afterwards. You don't have the symptoms as much before. But there's a term called peripartum, which is a little bit more of a catch-all term in that it also describes pregnancy-related depression that happens during the pregnancy and can happen for an extended period of time, up to 12 months after the delivery. And so it's a little bit of a broader definition, and probably just to help capture a lot more people who might be having the symptoms, but didn't meet the criteria for postpartum depression. So we'll talk a little bit about what the definition of peripartum depression is. We'll talk a little bit about that compared to postpartum, and then treatment options from a Western medicine standpoint, and then also how we look at it in Chinese medicine. So just talking a little bit first about peripartum depression. The symptoms for peripartum depression and postpartum depression is basically depression symptoms that are associated with pregnancy. So with just regular depression, we consider a few different symptoms to be associated with depression. Just a broad classification, you feel depressed, you feel sad about things that are happening for whatever reason. You may not have a specific thing that you can point to. And then there's other symptoms like there's a term called anhedonia, meaning you don't find pleasure in things that you would have otherwise normally found pleasure in. So, for example, if you love watching baseball and you no longer just enjoy watching baseball because of your depression, that's called anhedonia. It means you don't have an interest for that anymore. It doesn't bring you joy like it used to bring you. Decreased energy. People who have depression, they feel like they just don't have any energy. It's hard to get up, get out of the bed. You don't feel like doing anything throughout the day. You feel like your energy is all gone. Appetite. We see that a lot of people who have depression, they don't have much of an appetite. They don't have much interest in food. They don't really care about eating as much. So typically, patients who have depression will have decreased appetite as well. And then another common problem would be poor concentration. So patients who have depression, also you'll have difficulty with concentrating on things, trying to do mental tasks. All of those things can be harder to do when you have depression.
So, depression is one of the most common problems in pregnancy, and it's actually associated with a very high mortality in pregnancy. Um, some of the recent statistics, they found that from 2017 through 2019, 22.7% of pregnancy related death was due to a mental health condition. So, one fifth of women who died during pregnancy or around the time of pregnancy was related to mental health disorder, and depression being a big part of it. A lot of times when people are depressed, they don't have interest, they start having suicidal thoughts, and they might commit suicide. And so a big part of pregnancy related deaths is actually from mental health disorders. So this is a major problem, and it's something that you might have been a very normal person before this, never had depression problems. You might feel like you're well adjusted, you're in a good social environment, you have a stable home life. You might have a lot of things going for you, but this can still affect anybody. And it's hard to predict who it's going to affect. Now, there are some risk factors that have been identified, and we're going to talk about those too. Before that, I do want to say, now we talked about how it affects the mother. It also affects the child. So they've found that having peripartum depression can cause poor growth for the child. It can cause developmental delays where children may not be able to meet certain milestones that they should be at by a certain time, and also attachment disorders. So definitely having a negative health consequences on the mother can also affect the child. And depression, and especially severe depression, is not just bad for mom but also for baby. So it's something that we want to take seriously, and not just chalk it up to being, something that's of no consequence that we just need to fight through. It's something that is real. It can affect your health, it can affect your baby's health. And so it's something that we should look into helping if we can. And so those are some of the implications of peripartum depression for both mother and baby. Now, one of the interesting things that they've also found was just how much the pandemic affected depression. The depression rates for peripartum were uh, twice as high during the COVID pandemic as it was otherwise. And so, being isolated and in all those lockdowns and not having the same type of person to person interactions, all of those things can also play a role. Now, I said that you might have all those things and still have depression. That's true, but having good social interactions, family support, and other people can be something that definitely helps also. So that's also something that they noticed during the pandemic. Um, if you have had depression before, you had postpartum depression or peripartum depression in a prior pregnancy, then you are at higher risk for having that happen again. So that's something to keep in mind. I did say there are some risk factors, and having depression before is a um, is a risk factor. Um, Postpartum depression tends to peak the highest at about 3 months after delivery. So it can happen, or it can begin early on, and then it can peak down the line. So that's something else to keep in mind. Now, when we talk about what we do from a Western medicine standpoint, it is recognized in Western medicine just how bad postpartum depression can be, peripartum depression be, and what a negative impact it can make on both mother and baby's life and development for the baby, like we talked about. So, actually, screening for depression is something that is recommended even for when you take your child to their pediatrician. Usually, at the first few visits, the 1 month visit, 2 month visit, 4 month, and 6 month visit, oftentimes your doctor or the clinic will ask you if you are having any symptoms of depression, and just try to help identify whether that's something that is going on with you, so that they can reach out to you, ask more questions about it, and talk about ways that they may be able to help you with. So a lot of times, just with pediatric visits, a lot of the depression is identified because at the clinics, the doctor visits there, they may ask you about those things. Um, Now, when it comes to actual official diagnosis, um, as far as postpartum depression goes, they usually say in for postpartum depression, according to the DSM-5, which is like the major standardized criteria book for psychiatric disorders, depression has to occur within the first 4 weeks after delivery. So, in the first 4 weeks, that's when it tends to begin. And but peripartum depression, like I said, it's a little bit looser definition. It can happen. It can begin at any time during the pregnancy, and it can occur even after the pregnancy, up to 12 months after delivery. And we do in Western medicine differentiate that from what's called just baby blues, where baby blues happen about 2 to 3 days after delivery, and they tend to go away by about 10 days after delivery. And so it's a little bit shorter, it's a little bit more mild. It's much more common having baby blues. I think a large number of women will definitely feel just some emotional changes and depression after the delivery. And that can, like I said, it can be anywhere from 2 to 3 up to 10 days afterwards. Now, when we talk about actual full peripartum depression, postpartum depression, that lasts for over 2 weeks. It should last at least 2 weeks to be officially diagnosed as that. And so there's a little bit longer time frame that we use to refer to depression as opposed to baby blues, which tends to be a little bit shorter. When it comes to diagnosing peripartum depression, we don't do there's no specific blood work that's needed to diagnose it. There's no blood work that proves you have it. Some doctors might test for different things, but there's just nothing that you can really point to say that something else is causing the depression. And there's not really any recommendation to be doing a lot of other testing. If somebody has the classic symptoms of peripartum depression or postpartum depression, you can make the diagnosis as is. A lot of times people will check for thyroid or anemia or those kinds of things. That's pretty mild to do and check for. Again, it's hard to really, sometimes you can have abnormalities with those things around the pregnancy, anyways. And to try and attribute a real depression to that, it can be kind of tricky. So it's not clearly recommended that you should be testing those things, anyways. And then as far as treatment goes, there's a couple different things that are out there. And I would say the thing that the medical literature has showed the most benefit for is doing some sort of behavioral therapy, working with a behavioral therapist and doing like talk therapy where they talk to you through your issues. They help identify things, the feelings that you're having that are associated with your depression, and also creating strategies to help you deal with that depression, and also help to just identify risk factors that you may have for worsening or suicidal thoughts, and trying to help prevent those. And so behavioral therapy is um, a probably a more well-established thing to do if you are having peripartum depression. Even people who are at risk for depression, they've shown that doing behavioral psychotherapy can help reduce the risk of actually developing full peripartum depression. Um, and then I wanted to talk a little bit before I get into the Chinese medicine side of things. I did want to talk a little bit about medication treatment. That is a question that comes up a lot as well. And there's two things that we want to separate. There's the time period during the pregnancy when the mother is actually pregnant. And during that period, we consider the consequences of medications on the pregnancy. And then postpartum, when after the delivery, we consider the pros and cons of taking um, medications while a mother may be breastfeeding. So those are kind of the two different ways to break up the questions of medications. Now, when it comes to actual medications, the main class of medications that is used during peripartum depression and postpartum depression are the SSRIs, or the selective serotonin reuptake inhibitors. We've probably talked about this class of medications on prior podcasts. The SSRIs are, as the name suggests, it's a class of medication that affects the amount of serotonin in the body, and how much it's taken up. And there's several different types of SSRIs, and different doctors have different preferences for how they prescribe one over the other. If you've heard of medications like Zoloft, that's an example of an SSRI. That's a common one. Zoloft, Paxil, fluoxetine, those are common ones that are used. Now, interestingly, so what I'll do is I'll talk about it a little bit. We'll talk about it, these medications, during the pregnancy period, and then I'll separately talk about it after the pregnancy. So first of all, during the pregnancy period, there are a couple medications that has been shown to cause a higher risk of birth defects. And those two medications are paroxetine and fluoxetine. So, in general, if you do need depression medications during pregnancy, most SSRIs are considered a little safer than paroxetine and fluoxetine. Those are the two that we try to avoid during pregnancy, just because of higher birth defects that have been found that those have caused. The different types of birth defects, they can cause defects to the central nervous system and brain development. They can cause cardiac defects as well. And so they do have a higher risk. It doesn't mean that your baby will automatically have any of those problems if you are on those medications. But in general, we try to avoid those medications if you are pregnant. So there are other medications that are SSRIs, but are not those two medications. Other examples are citalopram, escitalopram, sertraline is another option. So, but the two main ones, fluoxetine and paroxetine, are associated to have higher risk during pregnancy. Now, some people have depression and they're already on medications before they become pregnant. They may even be on the medications for a while before they even know they're pregnant. And it's not as clear what to do in those situations. That's a very individualized decision that you want to make with your doctor. It really depends on how long you've had depression for, how severe it is, what other medications you may have tried. Again, we always want to balance the pros and cons, because like I said earlier, having peripartum depression, postpartum depression, it does have negative consequences on mother and baby, and those consequences may be worse than the medications you're taking, than the risk of getting um, off of your depression medications may be higher than actually just staying on them and taking the risk. A lot of, I would say, a majority of psychiatric medications, we don't have a full knowledge of what the effects are in pregnancy, because in general, nobody wants to try it out on their child. And so um and so it's unknown what a lot of the effects are, but we have to balance out what are the known problems versus the unknowns. And if you've had serious depression and it can cause a lot of problems when you come off your medications, then for you it might be better to stay on. If you've had mild symptoms and you're going to be more anxious about what could happen to your baby, then maybe it's better to come off of it. So those are individualized decisions that you will want to make with your doctor on a one-to-one basis to decide what medicine you should do, whether you should stay on, whether you should alternate or try something else. And then, so that's a little bit about about the medications during pregnancy. Now, when we come to actual postpartum period and when it's during after delivery, because like I said, peripartum depression can happen up to 12 months later. So we also think about afterwards. When it comes to the afterwards, the postpartum period, the question is really related to breastfeeding. Breastfeeding is uh, the best source of nutrition for your baby, and a lot of women do want to breastfeed. If you are breastfeeding, then you also do consider the types of medications you're taking. Now, if you are not breastfeeding, then then you don't have to consider the effects of any medication passing through the breast milk. The big picture as far as medications go for pregnancy is that most for breastfeeding is that most medications have not really been tested for breastfeeding. Um, they mainly recommend that you need to monitor and see if there's any changes to your child, if you are um, on any medications um, that 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 could affect breastfeeding. There's a whole list of different medications, and again, the common ones: citalopram, escitalopram, fluoxetine, paroxetine. The safety profile is uh, they classify them as safer, moderately safe, and they have various different recommendations, but there's not any widespread testing on those. So that's a little bit about the medications. Other things that people do try to help with depression: physical activity, exercising. Some people try vitamin D, omega fatty acids. It's not really clearly demonstrated that those things can make definitive benefits, but those are other things that may be able to help. So that's a little bit about it from the Western medicine standpoint. One other thing I did want to mention when it comes to the treatment aspect, and that is specifically, they did a Danish study that looked at women who were on SSRIs, and they did find that they had a little bit higher rate of preterm delivery, 8.8% versus 5%. And they also had a little bit higher rate of infants needing to be admitted to the NICU or the intensive care unit, 16.4% versus 9%. So it does have some effects, but again, it's hard to really definitively say whether you should do one or the other. It's really a case dependent and how severe it is, how much you need the medications, and the benefits that they provide for you. So that's an individualized decision. Now, I did want to talk a little bit about it from a Chinese medicine perspective because, um, as we talked about it, all those medications do have side effects, and for a lot of women, they may be able to manage without it, or they want to look to trying Chinese medicine as another form of treatment um, to to help treat depression and avoid some of those negative consequences. Now, the big picture thing I want to talk about from Chinese medicine perspective is just how do we what do in Chinese medicine, what do we think is the underlying problems that are happening that result in depression? And then we'll just talk a little bit about some of the herbal treatments and acupuncture philosophy to help with peripartum depression and postpartum depression. Now, in peripartum depression, in Chinese medicine, I'm going to use a little bit different terminology. I'll just use depression associated during pregnancy and then associated after pregnancy, because in Chinese medicine, the actual physiologic process of what's happening with the birth and the what's happening during pregnancy, the growth of the child, and then the eventual delivery is intrinsically tied to the the effect of what's happening to cause depression or not. Now, in peripartum depression, so when we have during the pregnancy, there's a few different things that are happening that can be attributed also to depression symptoms. So, two of the things that are happening is the kidney and the spleen are working in Chinese medicine to help support the body during the pregnancy. And it uses a bit of the yang energy of both the kidney and the spleen. And also, if you've done other treatments, or if you've had infertility or gone through IVF treatments, those can also deplete the yang energy. So when it comes time to actually have the pregnancy, you might already have some yang deficiency if you've overworked or been under a lot of stress or had um, a lot of just difficult situations in your personal life. That can also deplete the yang energy of the kidney and spleen, and so that can also cause you to have insufficient yang energy in the kidney and spleen. And as your body is trying to nourish the fetus and support it with the jing, the essence, the chi that it needs for the baby to grow, it also depletes your own yang energy supply. And so in those scenarios, you can have a lot of similar symptoms. You can feel just no energy, very tired, hard to enjoy certain things, and low appetite. And so in those scenarios, we use formulas to help support the kidney and spleen yang energy. So a commonly used herb is tu tzi, and I've talked about that herb separately. And that's an herb that helps to support the yang energy, especially of the kidneys, and it helps. It's more of a neutral herb. It's not particularly warm or cold, and it can help support the kidney yang energy, help support the spleen yang energy. Um, and then the other thing I wanted to talk about is the other aspect that can commonly happen in Chinese medicine is deficiency of the kidney and liver. And this is something that can happen during the pregnancy, but we definitely see a lot more of it after pregnancy. So after the delivery, a woman loses a large amount of blood and substance in her body, and she can become very blood deficient. Now, in Chinese medicine, we use the word blood deficient, and it's not exactly the same thing as being anemic, but you can kind of consider it as a parallel. But it's not the exact same thing. In Chinese medicine, the delivery process itself causes you to become yin deficient and blood deficient. And so in Chinese medicine, actually, it's fairly important after the delivery to help support and tonify the yin energy for a woman's body. And a major depletion in the kidney and liver yin energy of the body can cause depression symptoms. It can also cause a lot of the same things: feeling tired, not having any interest, not having much concentration, feeling a lot of emotional fluctuation. A lot of those things happen because of the precipitous drop in the kidney and liver yin energy after delivery. So when it comes to replacing and repleting the kidney and liver energy, there's a few herbs. Go Qi is a herb that we commonly use. Shu Di Huang is another herb that we use oftentimes. Dang Gui, Bai Shao, those are two herbs that specifically build up the blood in the body. The blood is a product of the kidney and liver yin energy. You need the kidney and liver yin to produce blood in Chinese medicine. And so with all the blood loss that is associated with pregnancy, you have a rapid decline in the blood volume in your body. And then that stresses the kidney and liver to produce more yin, and it can deplete the kidney and liver yin. So that's a little bit of how in Chinese medicine we do consider depression to be both during pregnancy and after pregnancy, but it's very different. If you notice how I talked about it in Western medicine, whether you have depression during pregnancy or postpartum in that after delivery portion, the treatment is still about the same. You use the same medications, but in Chinese medicine, they can have very different etiologies based on the physiology of what's happening during the pregnancy and how that's affecting the woman's physiology. And so When we do acupuncture for depression, like I said, if it's a problem affecting the kidney and the spleen yang, then we're going to use points along the kidney and spleen channel. A lot of points maybe in the legs to and maybe in the central abdomen to help support both the kidney and the spleen yang energy. If it's a postpartum depression and we're having problems with liver and kidneys, then we are going to probably target more points along the liver channel and the kidney channel, and especially points to help tonify and build up the yin energy, help support the blood in the body as well. And that's what we'll be focusing on during the acupuncture treatment. And so I think those are some great approaches in Chinese medicine to treating peripartum depression and postpartum depression. And everyone's a little bit different. Some people may benefit from having the Western medicine approach. Some people may benefit from the Chinese medicine approach. I think most people are usually somewhere in the middle where we do need help from Western medicine, but there's also a lot that Chinese medicine can offer. So, as always, thank you for joining us for today's podcast. And it was a pleasure getting to discuss peripartum and postpartum depression. And if it's something that affects you, this can be a serious problem, like we talked about at the beginning. And we would love to hear your story and how it's been affecting you, and talk about with you if there's anything that we can do to help you in your particular situation. If you would like more information, reach out to us at www.houstonacupuncture.com. And we will see you next time on the East Meets West podcast. Bye-bye.